Looking for a reliable contraceptive with a less demanding schedule? Consider using a contraceptive ring, also known as the ring. When using the ring, you only have to worry about it twice a month. And if you happen to not be using it for up to 3 hours when you should be, you can easily place it back in and the effectiveness will not be altered. If you wish to stop using the contraceptive, you can easily do so by removing the ring. The ring can help bring benefits to the menstrual cycle by making it more regular and having lighter periods. It can also benefit your health in the future by preventing complications in the reproductive organs such as uterine infections and ovarian cancers. To get a contraceptive ring, it must be prescribed by a medical professional, and the cost can range from $0 to $2,200 depending on the brand you choose and whether or not your insurance covers it. Here we see two of the more popular ring brands. The Nuva ring must be replaced every month, and the Innovera ring can be reused for up to 1 year. To effectively use the ring, it must be inserted once a month on the same day and removed during the week of your period. If you're using the Nuva ring brand, you can choose to skip your period by simply leaving it on throughout the whole month. For insertion of the ring, you can do so easily by following 5 steps. First, you want to make sure you're handling the ring with clean, washed hands. Then, with the flexibility of the ring, you can pinch it to create a sort of notch for easy insertion. Once you're ready to insert, you insert in the vaginal opening, and then using your index finger, you push it back towards your cervix. Once the ring has been inserted correctly, it should be sitting in a comfortable position around the cervix. The ring is a hormonal contraception, so once it is placed, it releases estrogen and progesterone hormones through the vaginal tissue. These hormones help prevent pregnancy in 2 ways: by thickening the cervical mucus, which makes it difficult for sperm to enter the uterus through the cervix and toward the fallopian tube. They also help prevent ovulation, which is the releasing of the egg. Without an egg to fertilize, the sperm will not be viable. The failure rates of the contraceptive ring depend on how well you follow the instructions. With perfect use, the failure rate is as low as 1%. But we know life happens and you may forget to insert the ring or it accidentally slips off. This leaves you with a typical use failure rate of around 7 to 9%. Now that we looked at the positives of the ring, we can look at the negatives to make a well-informed decision. First off, the ring does not protect against sexually transmitted diseases or infections, so it is recommended to be used along with a condom during sexual activity. The effectiveness of the ring can also be altered when used with specific medication or drugs, so you want to talk to your doctor about any current medications you're using or plan to use in the future to make sure the ring will still be effective. Side effects of the ring are similar to that of the contraceptive pill, which should not be persistent for more than 3 months. Since the ring is placed in the vaginal canal for long periods of time, it can lead to irritation, infection, or discomfort. It can also increase your risks of blood clots. Compared to other contraceptive methods, the cost of the contraceptive ring can be relatively expensive, so you want to make sure it's well around your budget. Now that you have more general information of the ring, you can talk to your medical advisor to see if it's the right contraceptive for you.